Welcome to our Sunday specials. Well, 1 month after the rollout of the COVID-19 vaccine in Nigeria, the federal government moves to halt vaccination halfway across states for more vaccines to arrive. Well, priority is now placed on recipients of the first dose for them to complete their vaccination. In this special report, Abimbola Agbebiyi takes a look at the issues this decision might bring.
On Tuesday, the second day of March, Nigeria received 3.92 million doses of the COVID-19 vaccine. It is the first shipment for the over 16 million doses allocated to the country through the COVAX facility aimed at vaccinating 20% of the population. The vaccine doses were to be rolled out in 4 phases. The first recipients are the frontline health workers and strategic leadership, then individuals from ages 50 years and above. The third phase is expected to cover individuals between ages 18 to 49 with relevant medical conditions, while the last group are the remaining eligible population, which comprise individuals of ages 18 to 49 without relevant medical conditions. But since the vaccine rollout, what has changed in Nigeria?
We've not done badly at all in terms of our response, in terms of how we have been able to mobilize the available resources to tackle the COVID-19. There are times where we had just an average, more people saying they don't believe in COVID, now more people believe in COVID. A time when people didn't believe in wearing face masks, now more people do. Clearly, the vaccine has proven effective, proven safe. So I encourage everyone to go use the vaccine. There's nothing to be lost in using it. In fact, there's more to be lost by not using it than using a vaccine.
You wait for 15 minutes before you go.
Thank you. God bless you.
73-year-old Adefemi Kolawole Emmanuel has just taken the first jab. He shares his experience moments after the inoculation.
I just felt the sharp needle pain. That's all. That's the only thing I felt. Apart from the non-pharmaceutical preventive measures that we've been observing, I think with this one, I feel confident that I'm better protected.
Omolabake Badijo, also 73, seemed happy having taken the jab.
I feel fine because I didn't have any pain in my body.
On the 3rd of April, the federal government asked states administering the COVID-19 vaccine to stop the exercise the moment they use half of the doses allocated to them. These further raised more questions by some Nigerians.
In the first instance, how many are we in terms of population? We have about 200 million. Then, how many doses of AstraZeneca have they been able to procure for us? It then means that the rest of us that are not opportune to take it, we are on our own.
The awareness was not that long. The awareness of arrival of the vaccine for public use is not that. It's a short. The awareness was short. They should try as much as possible to provide it for we people like us that has not been vaccinated.
In what many may want to term as a harsh decision by the authorities, Minister of State for Health Mamura Olorunimbe told TVC News reasons behind this decision.
AstraZeneca, you need 2 doses. So, for those of us who have had the first dose, we are looking forward to having the second dose in about 12 weeks, or at least much later, beyond 6 weeks. Now, but unfortunately, the signals we are getting suggest that the vaccines may not come in as early as we thought. So in the circumstance, we felt that it makes sense to ensure that rather than keeping people hanging and waiting for the second dose that may not come on time, I think it's just a matter of good judgment or wisdom, if you like, to stop it halfway. That is the number of, if you take for example, if you have 50,000 doses It's better to apply 25 doses and now give the remaining 25 doses to those that have taken the first dose, so that within a given point in time, we can say that we have this number of people that have been fully vaccinated.
While shortage of vaccine supply is now the new challenge countries are battling, here is a population chart showing the number of doses administered so far in Nigeria. As at the time of filing this report, Nigeria is yet to hit the 1 million mark, making it the least vaccinated with 964,000 doses given so far. United States of America tops the chart with 167 million doses given so far. 62.8% of its entire population have been fully vaccinated, which makes it 20.8%. China follows with 161 million people recorded to have taken the first jab. India has 98.1 million vaccinated and 12.3 million fully vaccinated. United Kingdom has 38.4 million doses administered so far, with 6.54 million people fully vaccinated. Nigeria presently looks to other sources for vaccine supply, but it remains uncertain on when it will arrive.
Seriously, let me be honest, I cannot tell you. We still believe that the vaccines will come, but we may not be able to say we'll receive these vaccines in the next 2 weeks or in the next 3 weeks. It's a function of when the vaccines are ready for delivery. So that's where we are right now.
Clinical trials on 2 COVID-19 vaccines developed by some Nigerian scientists have just started. This might be some scientific breakthrough for Nigeria as the country awaits completion of trials and obtaining of relevant certification.
While Nigeria continues to push for more vaccines, medical experts say the need to keep to non-pharmaceutical interventions remains key. Abimbola Agbebiyi, TVC News, Lagos.